task 1, preparing serum and plasma for preoperative blood work. This is Cece. She's a 10-year-old female spayed pug weighing 5.4 kilograms. I've got my gloves here, a 22 gauge needle, a 6 cc syringe, and 3 blood tubes. So I've got my lavender top with my EDTA anticoagulant additive and 2 serum separators, plain red top and a tiger top, as well as my alcohol. So we're going to draw our blood from the jugular and go ahead and put my gloves on. I'll ask my assistant to go ahead and restrain her head. Hold off at the thoracic inlet and feel for the whistle. Go ahead and put my needle on my syringe. And break the seal on my syringe by pulling the plunger back. I'm going to spray the area with some alcohol to help visualize the vein. Insert with my bevel up. And draw back slowly to try to prevent any slicing or damage to the red blood cells. Okay, I'll place my finger at the insertion site, ask my assistant to hold off. I'm going to place my blood first in my lavender top with my anticoagulant additive. Okay, I'm going to fill that up to the black marker on the tube. I'll invert that 3 to 4 times.
Make sure you show the tubes too.
Then I'll go ahead and fill up my serum separators. And I do not need to invert these as they don't have any anticoagulant additives. And then we'll go ahead and label our tubes with our patient's name, species, and date. We're going to allow our serum separators, just so you can see that those are labeled, name, date, and species. We're going to allow our serum separators with 20 to 30 minutes to go ahead and clot, and then we'll spin. All right, so now that we've allowed CC's serum separator tubes to about 30 minutes to clot, we're going to go ahead and spin them down to harvest our serum. So I'm going to take our red top, and first I'm going to make sure to rim the tube. This is just going to break the clot loose from the edges of the tube. Just stick it in and spin it around. And I'm going to use the end of a cotton tip applicator to do so. Go ahead and put the cap back on that. Now, because even though we did get 2 serum separators, they're of different amounts, so I'm going to use a balancer tube to balance each of them. So as you can see, those are about the same amount. I'm going to place them in the centrifuge directly across from each other. So I place our balancer tube in number 7 and our sample tube in number 3. I'm going to go ahead and do the same with our other sample. So I'll open it up, rim it with the end of our cotton tip applicator just to make sure the sample is, or the clot is broken from the edge. Close the tube, get our balancer tube, which once again, you can see they're about the same amount. I'm going to place these in number 5 and number 1. Our manufacturer settings for this particular centrifuge are going to spin our blood at 3,300 RPMs for 10 minutes. Go ahead and close that, hit run, and we'll be back in 10 minutes once our blood is finished spinning. Alright, so our blood tubes have completely finished spinning in our centrifuge. Just going to go ahead and harvest our serum using a disposable pipette, and then I've got a plain tube with no additive, and I've gone ahead and labeled that with the patient's name, ID number, and date. Just going to go ahead and remove our samples from the centrifuge. So there's our clot activator. It's got some very mild hemolysis, but overall a clean sample. And our serum separator tube, once again, some very mild hemolysis. Doesn't appear to be lipemic. Overall, a very clean sample. We'll go ahead and harvest our serum into our plain no additive top. So I'm just going to open that and set it in our rack. I'm going to do our serum separator first. I'm going to use my disposable pipette and squeeze, dip in, and harvest the serum. I'm going to place that in my no additive tube. Go ahead and do the same with our clot activator tube. This one, it is important to be very careful not to suck up any of the clot itself. You just want to get the serum. Okay, and I am going to go ahead and place this in the same tube. It's the same patient and the same blood draw, as well as using the same pipette. Okay, and there we have our harvested serum. We can go ahead and run our blood work or send it out for an outside lab to run for us. Alright, so we're going to go ahead and prepare our plasma to be harvested. So I've got my lavender EDTA anticoagulant sample here. I've gone ahead and pre-selected a balancing tube for the centrifuge. So I'm going to go ahead and place both tubes within the centrifuge. So I'm going to put my lavender tube in number 8, and then my balancer tube directly across from it, which is going to be number 4. Close my top, and I am going to use the manufacturer's recommendations for whole blood while spinning. So we're going to do 3,300 RPMs for 10 minutes. I'm going to go ahead and start that, and we'll be back once it's finished spinning. Alright, so now that our sample is finished spinning, I'm going to go ahead and harvest our plasma. So, take my sample out. looks like we've got a fairly clean plasma sample, maybe slightly lipemic, but overall pretty good. Set that there. I've got my no additive plain top. I'll go ahead and label this with CC's information. And I've got my disposable pipette. Go ahead and open my tube. Remove the top off of my lavender top. Use my pipette. Harvest my plasma. Place that in my plain tube. Right, and then our sample is ready to be run. So I'm going to go ahead and discuss the causes and effects of hemolysis and lipemia. We've got a couple of examples here. So we're going to start out with our hemolysis. So this is an example of a hemolyzed serum sample. Hemolysis can be caused in a couple different ways. So if you have excess alcohol on your skin or your hair when drawing your sample, if you force your blood into your tube when you're placing your sample in your tube, if you vigorously invert your sample within your tube, if you draw the blood into a moist syringe, or just by a disease process the pet may have. Hemolysis can, when hemolysis occurs, you are actually damaging your red blood cells, which in turn is releasing constituents that are normally intracellular into the extracellular fluid, which can dilute your sample or falsely increase your values in the intracellular constituents as they're now in the extracellular fluid where they would not normally be. It can interfere with values such as your lipase, bilirubin, phosphorus, potassium, or your enzymes. Here's an example of a lipemic serum sample. So lipemia is caused by the patient not properly being fasted and having a fatty meal prior to your blood draw. Lipemia can cause hemolysis itself. It can cause dilution of your sample. It can cause increases in things like your total protein, as well as your glucose or your liver enzymes, and it can cause decreases in your pancreatic enzymes such as your lipase and amylase. I've got an example of a clean serum sample here. So it's nice, clear, and probably straw colored would be a good term to use. Okay. And then we've also got a couple samples of our plasma. So we've got a hemolyzed plasma sample. And a mildly lipemic plasma sample. Okay, and that's the end of our plasma and serum collection techniques.